Hi guys, my name is Simone and I have borderline personality disorder, and I honestly don't give a fuck about saying it anymore, and it feels really fucking good to say it. I was diagnosed with borderline personality disorder when I was 22, and I've always been comfortable divulging to people I have PTSD, I suffer with dissociation, as hard as that is, but I've never wanted to say to people, only close friends and family, that I have borderline personality disorder, and anyone out there I'm sure can relate as to why. This disorder is highly stigmatized. It's highly stigmatized, I think, number one, for the name. Borderline personality disorder is very misleading. They're actually in the process at the moment of changing the name, so we have the option of going for emotional dysregulation disorder. There's actually, interesting enough, 40 different terms for this disorder. They have emotional dysregulation disorder, which is what I prefer to use. Or we could go by emotionally unstable personality disorder if we want. The reason I'm making this video is because it's highly stigmatized, and I'm a person who I like to fucking talk about who I am. I'm open about the fact that I'm bisexual, pansexual. I kind of go between those two labels. I would say more pansexual. I'm very open about that. I'm open about the fact that I have PTSD. I'm open about the fact that I've been through abuse in my life and all of these things, but you're just afraid to say the name borderline personality disorder because it sounds insane. Where borderline personality disorder originally came from was doctors thought that people with borderline personality disorder were somewhere on the cusp of the having neurosis or psychosis or schizophrenia, things like that, or the other kind of disorders that would be here. And they were somewhere on the cusp, and they no longer believe that. Borderline personality disorder wasn't discovered until the 80s, and we didn't have a term for it until the 80s, so it was very behind in research at the time. The only kind of representation that I have seen is if you've ever seen the movie Girl Interrupted. I remember watching that movie. It became one of my favourite movies ever. It was a little bit behind, as I said, because borderline personality disorder was only recognised in the 80s. But yeah, if you've seen Girl Interrupted, you would have seen borderline personality disorder in that. Or, as of late, we've had celebrities come out and talk about it. So we've had Lady Gaga has opened up, I believe it was last year, about suffering borderline personality disorder. So we've Lady Gaga, Angelina Jolie recently opened up too, and Pete Davidson. And I think it's great. It's finally kind of seeing these celebrities talking out about it kind of makes it easier. And it kind of got me thinking, like, I've wanted to make this video for years. Like, since I wanted to start YouTube, I wanted to make this video. But I was afraid. And then I see these people like Lady Gaga, Angelina Jolie, Pete Davidson coming out and talking about it, and they've got this huge following, and their whole career is based on how people see them, and they have the balls to come out and say it. And I just thought it was about time. How I'm going to do this video is I'm going to give you an idea of what borderline personality disorder is. I know a lot of people, I'm going to be putting this into the support groups and things that I'm on, so a lot of people will know what it is, but I'm going to give an idea of what it is for anyone who's new and anyone who doesn't understand it, because I think it's very important that if you feel like you have a voice and you can do it, to do it. And secondly, I'm going to give a little bit of insight. I am going to make further videos down the line about myself and how it affects me and how the different traits apply to me, because not everyone has BPDs the same. There's things known as quiet borderline, there's outward borderline, there's different subparts to it. But I'm going to explain BPD in this video and give you a little bit of information and get to know me a little bit. So yeah, let's get to it. I will mention that I have taken down some notes. All of these notes that I've gotten have been gotten from credited medical sites. I'm going to leave all the links in the bio. But yeah, if you see me looking down, I've got my handy dandy laptop here to help me, because anyone who has BPD knows dissociation station, so I got a point of reference here. But I'll leave the links to where I got all this information from. So before I get into the video, I want to start by debunking some of the myths, because, as I said, the name is very misleading, and let's just start with that. People with BPD do not have multiple personalities. More so than that, it was never believed that they did, hence the name being so misleading. I mean, you hear borderline personalities, you would think multiple personalities, am I right? But no, people with BPD do not have multiple personalities. According to Dr. Evelyn McCabe, a clinical specializing in the treatment of these patients, borderline personality disorder continues to be a very stigmatized condition, but it can be treated with talk therapy, of which psychiatrists need to be well informed. At the moment, the name BPD is under review and is soon to be changed in the Diagnostic and Statistical Manual of Mental Health Disorders. the DSM. Sorry guys, my voice is going there. So guys, before I jump into exactly what borderline personality disorder is, I'm going to read off some statistics. These statistics alone are staggering, and if the whole reason behind the driving force as to why I want to make this video, why I think it's so important to speak out and be a voice and be a point of reference if I can. These, like I said, these statistics are absolutely staggering, and it just shows why it's so important to talk about this disorder. So, without further ado, in the United States, I'm going to go into the American statistics and I'll do the Irish statistics too. In the United States, recent research has shown that 1.6% of the population is BPD. That means that over 4 million people in the USA are suffering with this disorder. 10% of adults with BPD will commit suicide. 55 to 85% of adults with BPD will self-injure their own bodies. 33% of youth who commit suicide have features of BPD. I'll read that one again. 33% of youth who commit suicide have features of BPD. About 85% of people with BPD also meet the diagnostic criteria for another mental disorder, like me, PTSD, anxiety, depression. 38% of adults with BPD are prescribed medication. Up to 40% of regular users of mental health services have BPD. Over 50% of people with BPD are severely impaired in employment. BPD is implicated in 17% of the prison population. 38% of those with BPD have substance abuse or drug dependency. The Irish statistics are roughly 2% of the Irish population suffer BPD. Now, I know compared to the USA, that can sound like a small number, 10% in the USA, 2% here, but when you consider the size of America compared to Ireland, the number is about the same. The HSE estimates that up to 60 to 70% of people with BPD will try and take their own lives, and 10% of those are estimated to succeed in their suicide attempt. In addition to this, multiple studies have been carried out investigating the prevalence of childhood abuse and neglect among adult borderline personality disorder sufferers, and the results are staggering. Between 40 and 86% of BPD sufferers report sexual abuse. Up to 75% say that they were emotionally abused. Up to 73% report physical abuse. And between 17 and 25% experience severe emotional neglect. And then they wrote in, children depend on parents and other children depend on parents and other trusted caretakers to provide a safe, loving and supporting environment. And when that does not happen, the long-term consequences can be devastating. So what we see here is the prevalence and the experiences of abuse amongst BPD sufferers is absolutely staggering. I think it kind of speaks for itself. It is very, very sad that people like me, and I can speak for myself, I'm not going to go too much into it, but I have dealt with a lot of abuse, emotional, physical, everything, really. And I'm not saying that to hurt anyone, and I know family members of mine will be watching this and they're very, very supportive. Most of them are very supportive. I'm not saying it to hurt people, I'm just saying it to break down some of the stigma. I think it is so unfair that we go through these things and we suffer, and then because of the title that was put on our group of coping mechanisms, we are ostracized and misunderstood, and yeah, we're just left to feel like the outcasts, like we don't really fit in because we can't talk to people about it. So yeah, I just wanted to say that, like, it's absolutely staggering, and the numbers kind of speak for themselves. So, what is borderline personality disorder? The American Psychiatric Association describes BPD as a pervasive pattern of instability of interpersonal relationships, self-image, and affects and marked impulsivity, beginning by early adulthood and present in a variety of contexts. BPD is marked by a pattern of unstable relationships, unformed sense of identity, chronic feelings of emptiness, unstable moods, poor impulse control in one or more areas such as spending, eating, sex, or substance abuse. If you have BPD, you probably feel like you are on an emotional roller coaster. Your self-image, goals, and even your likes and dislikes may change frequently in ways that feel confusing and unclear. So I can only talk for myself here, and like I said, I'm going to be transparent as I can. I have suffered myself, as they mentioned here, I have suffered with self-harm. Not anymore, thank God, but I have suffered with self-harm. I have suffered with body image in the sense of I always think that I am bigger than what I am, and that's something hard to admit, but here we go. I want to break down the stigma. I have suffered with body image issues. I've suffered with suicidal thoughts. I have definitely suffered in the past with promiscuity, sleeping with people that I kind of regret I did now. I'm way more conscious of that now as an adult. I'm a lot more conscious of a lot of these things. I think that happens with age, you know, we start to, but the disorder's still there. You kind of might internalize it a bit more rather than acting out on it, which is what happened with me. I internalize a lot of this now. I try not to act on it, but impulsivity would have been a huge one. Risky behaviors, just really, really risky behaviors, always chasing that high, always chasing that chaos, always wanting to get, you know, really, really drunk, or, you know, get with somebody that's going to distract you for the night and distract you from all of the pain that you were feeling. So I can relate to that. People with BPD tend to be extremely sensitive. I prefer the term empath, but yeah, this is true. People with BPD tend to be extremely sensitive. Some describe it as like having an exposed nerve ending. Small things can trigger intense reactions, and once upset, you do have trouble calming down. It's easy to understand how this emotional volatility and inability to self-soothe leads to relationship turmoil and impulsive, even reckless behavior. I can speak for this again, not so much at the moment. I'm a very spiritual person too, so I'm very much at the moment trying to learn self-love. I'm staying single, I'm learning about myself and how these triggers work and what causes me to do the things that I do. But in the past, I can definitely say that it affected my relationships. I would say that I wasn't, maybe not in relationships with people that I should have been, people who could have understood my mental health, but at the end of the day, it's my responsibility. I was not the nicest person to be with. I was very untrusting of people. I was very triggered by certain facial expressions. So somebody made a facial expression that might seem neutral to someone else, to me seemed aggressive, and I would get triggered and I would fight. I just wasn't an easy person to be with, and that is a huge one, a lot across the border. And I think it's no matter how BPD presents itself in you, it's very, very, very common that it will affect your interpersonal relationships. A person with borderline personality disorder can experience episodes of anger, depression, and anxiety that last mainly for a few hours. So this is where we're different from people with bipolar. It's similar in ways, but with bipolar, you'll find that people go through periods of very, very high elation, and then they'll go through, which they call manic, and then they'll go through periods of very, very low, low lows. For us with BPD, it's kind of throughout the day. So I could wake up in the morning and think, ooh, I'm not able for today, I'm just too depressed, I can't handle this, I just want to stay in bed. And by lunchtime I could have perked myself up and I'm like, this is a great day, and then something small could happen that would affect someone else normally, or whatever normally, you know what I mean? But like somebody could make a smart comment, or one of my friends could be hurt, or something that upsets me, or I could see something on TV that triggers me, and that can set me off in that mood, and it's very hard for me. Then I have to self-regulate, I have to control it. It's kind of like constantly living on fight or flight. It is what it is. You constantly live on fight or flight. So when something bad happens, all of your emotions, you feel it so intensely. It's the same with love. It's the same with joy. We feel everything so intensely. Recognizing symptoms typically show up in adolescence, like I said earlier, or early adulthood, but early symptoms of the illness can occur in childhood. When you're in the throes of overwhelming emotion, it says here, when you are in the throes of overwhelming emotion, you're unable to think straight or stay grounded. You may say hurtful things or act out in dangerous or inappropriate ways that make you feel guilty or ashamed afterwards. It's a painful cycle that can feel impossible to escape, but it is not. And that kind of ties into what I was saying a minute ago, like when you're living under this extreme emotion and you feel everything so sensitive, you're so passionate, you're so sensitive to everything, that of course, like, and it's not justifying it, that's why I'm working on myself, but it's like someone says something small and you snap in that moment and you say something, and then that leads, like it says here, to you afterwards internalizing it and feeling guilty and feeling ashamed that you were even capable of saying those things. But it was the emotion. We feel things so deeply that the tiniest things can trigger us, and I'm working on it, but I will say it's a life. I wouldn't say it's a lifelong process, but it's a process. It's a process, and it's one that I'm proud and I'm very, very happy to be on, but it's a struggle every day. And I know I say that it's a struggle every day, and it is. When I talk about saying, oh, like self-harm, I don't really do it anymore, or this or that, that doesn't mean that the urge isn't still there. It's a struggle every day. Sometimes I want to roar and I want to scream at someone because I'm in so much pain, but I bite my tongue and I hold it. And that's what I hope to bring to this channel, is certain things that I've learned that help with my disorder, and talk on the bad days where I'm not so much in control of it. But mindfulness and meditation and all that for me were great, and I definitely want to put that forward, but I definitely just want to clarify that I'm no way healed. I'm still struggling with it, and I don't know when that will stop. So there is a silver lining, there is getting some bit better, but it's a struggle. It's a struggle. So now guys, before I drag this video on until next week, we're going to talk about the causes of BPD. So BPD tends to develop when people are in their late teens or 20s. However, it is not formally diagnosed until over the age of 18. It is taught that it is a result of a combination of genetics and the environment that somebody grew up in. So what they mean here, with borderline personality disorder, it is commonly believed that you can have a genetic predisposition if someone in your family had it, if you grew up with a parent who had it, something like that. But it will lay dormant in your body until something in your life happens, something like traumatic happens to you, or ongoing traumas like that happen to you, trigger it. So like with things with like bipolar, schizophrenia and stuff, it could be just genetics. With BPD, it's a combination of genetics and the type of life and the type of things that you went through growing up. Those two things combined create BPD. Many people with BPD have experienced parental neglect, bullying or physical abuse, sexual abuse, or emotional abuse during their childhood. In many cases, co-occurring disorders will be present. I've mentioned that already. So now we're going to move on to the 9 traits of BPD. I got the 9 traits from the DSM, which is the diagnostic book that they use in every psychiatrist's office. You would go through, it's what they refer to diagnose you. Out of these 9 traits, you have to have 5 to qualify. I've already talked a lot about it, so I'm just going to kind of list them off. But you have to have 5. So if you're out there and you think that you might have BPD, I am not a doctor, but maybe grab a pen and paper, write down the ones that you think you have, bring it to your doctor, talk to your doctor, ask for a test. So the first one is fear of abandonment. Now, fear of abandonment can work one or two ways. It can be, and I've no shame in admitting it, before for me it was, I would be in relationships that I shouldn't be in, and I would break up with the person, and then and that we shouldn't be together because of me too. I was toxic, we were arguing, they had things going on, and I shouldn't have stayed in the relationship, but I would say, get out, let's break up, and then I'd beg them to come back even though I knew I wasn't happy. It was just like this intense fear of abandonment, this intense fear of being alone. Now I think I've gone the opposite way. Like I said, I think I'm more of quiet borderline at the moment. I internalize a lot rather than acting out and screaming and calling people names. I kind of internalize it, which is just as bad because I'm bullying myself. I work hard on that, don't worry, I work hard on it. The other thing is you can go the other way with abandonment, which means you'll keep everyone kind of on a romantic level, mostly I guess, but in a lot of aspects, keep people at a distance so that they can't get close to you. Because to you, when you're not healed or you're still in the throes of this, for me, I can speak, the thoughts of letting somebody truly love me terrifies me, and I have been burned a lot in the past. That would have something to do with it. I definitely think that BPD is a huge part of it though. I think subconsciously I am terrified of being hurt and abandoned, like I've experienced in my younger years as one of the things that I experienced. And I am terrified of that happening again, so I kind of keep everyone at arm's length. So the fear of abandonment can work both ways. Unstable relationships, we talked about that already, that's number 2. an unclear or shifting self-image. I've struggled with this all my life, but I don't mind this one because I love the fact that I try out new styles and I do this. But definitely in my younger years, I would cut my hair short and dye it black and, you know, be like that for a while, and then I might go blonde, and it was always kind of looking for who am I. And I think where this comes from is a lot of us, we didn't get the chance to develop a sense of self-image as a child. Our main thing as a child was survival or not pissing somebody off, and to not piss somebody off, you become a people pleaser and you morph yourself into becoming what that person wants you to be. So an unclear or shifting self-image is number 3. Impulsive, self-destructive behaviours, like I already mentioned. So if you have BPD, you may engage in harmful sensation behaviours, especially when you're upset. You may impulsively spend money you can't afford, binge eat, drive recklessly, engage in risky sex, or overdo it with drugs and alcohol. These risky behaviours may make you feel better in the moment, but they hurt you and those around you in the long term. So impulsive and self-destructive behaviours is number 4. Number 5 is self-harm or suicide behaviours. Like I already talked about, one of the biggest traits and something that they look for in the test when they're giving you the test is suicidal ideation. BPD, and it would make sense for the amount that we've been through. Suicide is something that it's like it's ingrained with this disorder. It regularly comes up, and like, not to be dramatic, but I'm going to be honest here, I could be washing the dishes and drop a cup and go, oh my god, like I wish I wasn't here. And I catch that thought now. I catch it, but it doesn't mean that that thought still doesn't come up. I've had suicide attempts in the past over bigger things than dropping a cup. One would hope. But sorry if I joke too, lads, I have a dark humour, it's how I deal with it. But suicide and suicide ideation is huge. So that is number 5. Number 6 is extreme emotional swings. Like we talked about earlier, you could be totally fine and then something could trigger you and you go off the absolute head. Chronic feelings of emptiness. People with BPD often talk about feeling empty, as if there's a hole or void inside them. At the extreme, you may feel as if you are nothing or nobody. This feeling is uncomfortable, so you may try to fill the void with things like drugs, food, sex again. My therapist said to me, and it made a lot of sense, I said to her, I said, I always feel like I'm missing something. I always feel empty, like there's this gaping hole in me, no matter how much work I do, no matter how much meditation I do, or spiritual work, or Reiki healing, or fucking, you know, anything that I can try to do, I always have this gaping hole. And it was hard advice. It was hard, but it was true, and it was needed said. She said, please stop looking. You might never find that again, because what it is something was stolen from us. Our childhood, our youth was stolen from us, and we can engage in things that help bring that playful side back, but that's where the feeling comes from. You're always longing for this part of yourself that you know you should have had inheritively as a part of your self-image that you never got the chance to have. So chronic feelings of emptiness is number 7. Number 8 is explosive anger, like I talked about already, if you don't work on it, and sometimes I slip up still. Explosive anger, so if somebody triggers you, my main thing is abusive men. So if I am around a friend's boyfriend who is abusive, or a man talks to me in a certain way, I get triggered and I can't control the anger that comes out of me then. If it's an abusive man, I have to be around them, chances are I'm going to at some point be screaming and roaring and threatening, and I can't at the moment get a hold of that. I won't see anyone be bullied, and I'm not saying all men are like that, I'm just saying aggressive men are my trigger. So explosive anger is number 8. Number 9 is feeling suspicious. So people with BPD often struggle with this. I think this again is because we've found it very, very hard to trust people in the past. So even sometimes someone new might come into our lives. I think it kind of happened to me recently. Someone new can come into, I wouldn't say recently, but recently, someone new can come into your life, and you might like that person, and you might want to go, like, let's say on a date with that person, or, you know, spend time with that person, and then they do something small and straight away you're kind of suspicious and untrusting, because our trust was so shattered that we're kind of like, okay, that's a red flag. Or you could be suspicious that people are out to get you, or people don't like you because our trust has been so broken, and that's something that we have to work on and learn to love and trust and all of these things. Again, it's basically like parenting yourself. We have to teach ourselves how to trust people, how to be okay, how to self-regulate, and all those things. So guys, if you've listened this far, thank you so much. The last thing I want to talk about is therapy. The silver lining with borderline personality disorder is it can be cured. It's not something that you have to carry on with for the rest of your life. It can be cured. It gets easier supposedly as you reach like your 30s, your mid-30s. I do feel like I've gotten a bit of a better hold on it. I understand myself more. I do a lot of spiritual work and all of those things. I still have the feelings. Like I said, I internalize them and sometimes they fucking come out, but I am working on it. But the biggest treatment plan or the best treatment plan is dialectical behavioral therapy. Now, I'm going to get really excited for a minute and I'm going to fangirl for a second, but there's this lady called Marsha Linehan. Now, Marsha Linehan had borderline personality disorder, and she had it in the 80s, 90s when it wasn't really well known. There were no real treatment plans for it. People kind of saw us as like attention seeking, fucking dramatic because of the suicide attempts and the drinking and the reckless behavior. It was just seen as kind of like attention seeking. Where so she had it around then, but there wasn't a lot of help around it. And Marsha Linehan studied herself, studied her borderline personality disorder, started to create DBT, dialectical behavioral therapy, this whole format on what dialectical behavioral therapy really is. It's learning how to, I wouldn't be able to explain it in one video, I'll do a separate video on it, but it's learning how to stop, pause, think, then react. And it's done in really, really good ways, like things like snapping the band on your wrist, getting ice cubes and holding it in your hand, anything that can kind of stop you in that tense emotion before you react. She studied herself, didn't tell people that she was doing this, didn't tell people that she had borderline personality disorder until she went to the people above her in the psychiatrists where she worked or whatever, I don't know what you call it, and she brought this to them, this worksheet, and they went crazy for it. They tried and tested it on many borderline personality disorder patients, and what they've seen is people very rapidly, very quickly started to get a whole lot better. She did not tell them she had BPD because of the stigma until she handed that onto their table. So for anyone out there who has watched this video who has BPD, look at Marsha Linehan, look at what we can achieve, look at Lady Gaga, look at Pete Davidson, look at Angelina Jolie, look at these people, look at Sammy Marie Grimm, who's here on YouTube, who talks about it. But mainly look at Marsha Linehan. I mean, to do something like that and create something like that we now use and we can thank her and we all use to help get us better. I'm currently on the waiting list. I actually got a letter yesterday that I have to go for an appointment, and I should be starting DBT really, really soon. So I'm very excited about that. But guys, I hope you enjoyed this video. I wanted it to be a bit of an educational video plus getting to know me a little bit. If you did, please subscribe. I'm going to be doing videos on the 9 traits and exactly how they affect me. I'm going to be doing videos on dialectical behavior therapy. I'm going to be doing videos on splitting. I'm going to be doing videos on dissociation, reckless behavior, just all the different subtexts that come along with this disorder. And I'm going to be doing videos on spirituality and how spirituality helps me and the different things that help me. So my BPD fucking warriors, this one was for you. And this was also for anyone out there, like sisters, brothers, loved ones, people who have it, that hopefully this can be a bit educational. I'm proud of myself for doing this. It's been a long time coming, and here's to many, many more. Thanks, guys. Peace out.